Hi, my name is Dr. Ross Hauser. Welcome to the Hauser Neck Center here in Fort Myers, Florida. Here with an amazing man, amazing story. Good response to prolotherapy, Paul. So why don't you just explain some of the things that happened to you in your past and why you ended up coming to Caring Medical, and how's the response been with prolotherapy?
Well, the response has been wonderful. I had some bad luck as a kid, early childhood trauma, tuned up my neck pretty good. I tried to manage it for a period of time through chiropractic care, physical therapy, that type of stuff. But as time went on and 50 got close, just the accumulated damage basically caused some pretty significant symptoms. You discovered that I had basically a compression of my jugular veins. When I was
what
laying down at
symptoms were you having?
This extraordinary head pressure, and like basically
it wouldn't go away.
It would not go away, and almost the inability to think. It was like that phenomenon you described, the toilet brain. There was it. It was very difficult to kind of get through the days. At one point, the bone had moved so far out of position that I started to get like muscle spasms all along the right side of my body. I thought it was a stroke.
Okay.
So I went to the hospital. You're fine. Go home. I saw everybody, doc. I saw the neurologist. I saw the neurosurgeon. I saw the orthopedic guy. Nobody could figure it out. You were able to figure it out with, I guess, that digital motion X-ray that you have. And then you put your finger on it right away. After the first treatment, the intraocular and intracranial pressure went right away.
Were you having eye pain too?
I was. It felt like I had like this band, doc, that's just this extraordinary
And it wouldn't go
pressure.
away?
It wouldn't.
Did you try medications?
So I had, like your ibuprofens or your Tylenols or whatnot, but it's tough to really address something of that caliber with an over-the-counter analgesic.
Were you starting to get like a little bit hopeless? Because you seem like, I mean, you come across as like a strong, independent kind of a guy.
Doc, I'll tell you, I was making my arrangements. I didn't know how it was going to play. I mean, I tried to be very pragmatic about my approach to life, but it was tough. After all the years that I had put into trying to stay both in shape and to take care of myself, to run up against a brick wall where every professional that you'd rely on is telling you, hey, listen, you're fine, and you know you're not.
Okay.
Then it's like, where do you look? So I did. I got online, doc, and I expanded my search greatly. I went from like my small community in the Northeast to a global search, and I found you.
Okay.
So, in every domain of life, there's a guy at the top. So.
Did you have some other symptoms? Like, was your digestive tract or your heart or any other symptoms, or or ringing of the ears or dizziness?
Actually, yes, pretty much all of it. Dizziness was intermittent. Ringing in the ears, I figured tinnitus was just kind of like an accumulated age thing, but it was present. Strange symptoms, doc. Heart rate variability symptoms. Almost like an anxiety, if you will.
But you're not normally an anxious person.
No, well, I'm one of those other side of life guys, doc. Skydiving, all that high adrenaline stuff.
I know, but normally those kind of people, they're not anxious kind of people. Like they're like go out and do life and.
Yes, I'm pretty dialed in as far as that goes. So you're right. It was not normal for me. I was pretty. I was put off. I didn't know what the heck.
And you were starting to get depressed and. Like you were starting to get lethargic, right? Like you didn't want to go do anything. Like you definitely didn't want to go do any of those things.
No, it was very difficult to get through the days, doc. It saps your life. It takes your energy.
Yeah.
And you described it. I mean, when you can't recover at night, right? When you're sleeping and you're really just your brain isn't refreshing itself because the blood can't get out. I mean,
the jugular veins were compressed.
Yeah, it was awful.
Digestive symptoms?
A little bit.
Not much.
Not too much, but thankfully the things started to regenerate with the prolotherapy. It's been amazing. I gotta be honest with you.
How many treatments have you had?
So 6 so far.
Okay.
And then I was hoping to basically just establish a maintenance schedule. I keep things moving in the right direction. I've been thankful for your help and for the care I've gotten with the physical therapy people.
Perfect.
The curve correction lady was awesome. Everybody's taking great care of me down here, doc.
What kind of work do you do?
I work as an attorney, so I'm stuck behind the desk.
Did you change your computer setup?
Everything, doc.
Okay.
Based on your recommendations. I've got, the screens are all higher up now.
Okay.
I've got the postural things going on. I want to make sure that, I don't reverse any of the good work that's been done so far. So.
Do you go into the office or you do it at home, your attorney stuff?
So we do have an office.
Do you go there?
I do. Yes, I do.
What did the staff there think of you doing the whole thing?
They were very not appreciative. They were very sensitive to it. They understood what was going on.
Okay.
They'd seen me.
But it didn't cause them to change.
No.
That's the interesting thing to me. Like, it would make sense. Like, they watch you go from this high-powered attorney to like really struggling. Yeah. Then I don't know, you just would think like people would be more open-minded, like, geez, if that happened to him, it could happen to me. You know, like with the neck, but you would say it hasn't made an effect.
Not in that way.
Okay.
You know, they were kind of dialed into the backstory too. I mean, it took a lot. It took a lot of different things kind of all coming together to get me to where I was. Just, you know, some bad luck things, and you know, but my luck turned around when I got down here to find you. So.
Here, and just you did say the word maintenance. I'm just let's just talk a little bit about that. So, what I usually tell people is once you're stable, as long as you maintain your neck curve, you just shouldn't need prolotherapy again. So prolotherapy is designed to resolve it.
Got it.
But if like you go back to, the crappy posture, right? Like you get your curve really good, but you go back to like addicted to the cell phone,
right.
Eventually the ligaments are going to get stretched out again. Here, I'm going to quiz you.
Sure.
Because,
Sure.
you seem like an intelligent guy, but I don't really know you.
I try.
Okay, so you're at work and somebody says, what treatment do you get down in Florida, and then what does that treatment do? So what's the treatment?
Well, my treatment is my prolotherapy.
Okay, so what is prolotherapy? How would you define prolotherapy to somebody?
It creates an inflammatory response, which basically causes the ligaments to kind of almost not contract, but basically heal themselves. It brings a bunch of all of your inflammatory markers and stuff into that area, and it causes basically healing in a localized way.
So why would that help you?
Well, the ligaments being overstretched are causing hypermobility for the joints and the bones, and that's what's going to kill me in my sleep. So you want those things to be, you want the foundation of the building to be strong. You want the rebar to be basically back in the shape that it's got to be in. Keep your head up.
I'll give you an A. That was good.
An A? Oh, all right. Wow.
No, it's amazing. Like sometimes, because I'll do that to the staff. Like we assume everybody understands what joint instability is, what prolotherapy is, what ligaments are. Oh, yeah. But you did a really, really good job. Because the point is you got to be stable. So if your head's sitting on something that's unstable, it's not going to be good for the brain.
No.
So, so obviously, every few visits, I don't know if, did you do a digital motion x-ray this trip or no?
I did, yep.
Okay. So here, let's just say we observed it and it's like, you got 90% of your stability. So then we would do this treatment, then typically 2 or 3 months after your last prolotherapy visit, because you live far away, you live in the Northeast, so you live far away. So 2 or 3, like I had a patient from England today, so today was their last visit. So I'm like, in about 2.5 months, you're going to get an x-ray. We'll see how the curve is. One of my staff will contact you to get a full history. Because if the full history is, Paul's doing really, really good, like this is better, that's better. He's got 95% of his things are resolved. And the curve is really good. You just got to, the maintenance is just get once a year, get a neck x-ray. Really, that's all you have to do. And that's really how healthcare should be ideally, that the healthcare provider teaches the person what they need to do. Because many conditions, they say that 2/3 of problems that cause disease are lifestyle things. Because you did have a lifestyle thing. You didn't know it. Like you're an attorney, so you're hunched over. Yep. Then addicted to the cell phone.
Yep.
So like you could have some injuries when you're younger, but let's be honest, like for hours and hours a day, your ligaments are getting stretched out. So you have the responsibility of just trying to have reasonable posture when you're working, and then you're good to go. So I appreciate you sharing your story, and I'm glad that
saved my life, Doc.
Did really good.
I don't want to die in my sleep. I didn't want to die in my sleep, and you stopped that from happening. So I can't be more
awesome,
thankful.
Paul. Great. Thanks again.
Thank you.